My name is Jennifer Spakeen, and I'm the Director of the Aging and Disability Resource Center here with Eau Claire County. Thank you for taking the time to view our resource video. We hope it provides you the information that you're looking for. Our ADRC provides services to older adults and adults with disabilities that live in our county. We also help those caring for individuals that are older or living with a disability, and professionals as well. We provide unbiased information and assistance, so if after this video you feel like you could use more information, don't hesitate to give us a call. ADRC services are open to anybody that is an Eau Claire County resident. There is no income requirement at all for our services, so please don't hesitate to give us a call. We hope you enjoy the video. Thank you.
Hello, I'm Sue, and I'm here to talk to you today about options for paying for long-term care services. A lot of times we have people come into our office looking toward the future and just wondering what's out there, and I'm not sure what kind of services I'm going to need, and how am I going to pay for it. So the things I'm going to talk to you about right now are private resources, private long-term care insurance, Medicare, VA, aid and attendance benefit, and last, publicly funded long-term care programs. So first, let's start with private resources. So basically, you're trying to invest in your future. And people often look at, how am I going to save up money? How am I going to use my money to the best advantage? Investing in your future might involve remodeling your home so that it can be more accessible as you age. It could include downsizing, so you live in a place that's a little more manageable for your needs. Often we encourage people to pay for small things early on. That can be things like anything that'll help keep you in your home longer. So it might involve home care, signing up for a personal emergency response system, you know, the one, help, I've fallen and I can't get up, that type of a system. Or Meals on Wheels, which would involve having meals come to your home. Sometimes it's those small things that allow you to manage independently in the community, so you don't need to go to the next level of care that's available out there. The last thing about private resources is that it's important for you to shop around. You usually don't buy a house by just looking at one house. You look at a number of different places to determine if they meet your needs. Is this a place that has enough room for me? Who are my neighbors? That type of thing. So you want to shop around for the services that you do get. In other words, you want to know your resources and how much they cost before you actually need them. So let's talk a little bit about private long-term care insurance. These type of insurances help cover long-term care needs, and you purchase them through an insurance agent. They help pay for things such as assisted living care, supportive home care or home care in your house or your apartment, and nursing home care. You really want to look around at the different insurance policies available, and you want to read the fine print, because some levels of care are needed in order to be able to use the services, the insurance. Sometimes you have a certain dollar amount that you're able to use for that insurance for your care, and once you've used that up, it's gone. So one of the ways that you can find out more information about long-term care insurances is by talking to the Office of the Commissioner of Insurance. Also, you can contact the Medigap helpline. Thank you very much.
When we talk about paying for long-term care, Medicare often comes up as a question. People wonder if Medicare does pay for long-term care. The important thing to know about Medicare is that its focus is on short-term services for conditions that are expected to improve. Medicare covers medically necessary care, which can include skilled nursing care, such as in a skilled nursing facility. It can pay for in-home skilled care, and it can also pay for hospice services. In order to get this in-home skilled care, hospice, or skilled nursing care paid for by Medicare, there are certain criteria that must be met. Another option for paying for long-term care can be through the VA or Veterans Administration. The VA offers what's called an aid and attendance benefit. Essentially, this is a tax-free pension to United States veterans. There are certain criteria that have to be met in order to receive the aid and attendance benefit. You have to have served 1 day during a war, have 90 days of total service, and not be dishonorably discharged. This aid and attendance benefit is available to those who are 65 or older and/or are disabled. If you're interested in learning more about the aid and attendance benefit, please contact your local VA office. On the slide, you will see the contact information for the local Eau Claire VA office. Lastly, when we talk about paying for long-term care, we will explore the publicly funded long-term care programs. The publicly funded long-term care programs are funded by Medicaid or medical assistance. So in order to qualify for these programs, you must qualify for and have medical assistance or Medicaid. These publicly funded long-term care programs include institutional Medicaid or medical assistance, which can help pay for long-term care in a skilled nursing facility. And the other publicly funded long-term care program is what we call community waiver medical assistance. Community waiver medical assistance can help pay for and provide services to those who need in their home. To qualify for the community waiver medical assistance, you need to go through your local Aging and Disability Resource Center. Your local ADRC determines eligibility for these programs. These community waiver medical assistance programs include the Family Care and IRIS programs. These programs were created to be an alternate to long-term care in a skilled nursing facility. When you look at these programs, it is not necessarily a guarantee of payment in an assisted living facility. If you're interested in knowing more about these programs, please contact our office.
Hello, my name is Emily Gilbertson and I'm the ADRC manager. I hope you got the information that you were looking for from our resource video. If not, or if you have more questions, we encourage you to call our office or stop by and set up an appointment. We also can meet with you right in your home. ADRC staff are available and excited to help you. Please contact us at the information provided to you on the screen.